Hello viewers, today in our Ask Doctor series we will see few of the questions or doubts the patient has asked in our comment section in the videos. So one of the patient is asking, I am 49 years, I completed family planning, I have 2 children and I have 4 fibroids, multiple. Large size is 5 centimeter, bleeding 2 times in a month, I feel pressure. What is your suggestion? So 49 your age, you are I guess you are there almost for the perimenopausal phase or menopause. Sometimes depending upon the family's genes and hormones, like your mothers and parents, grandmother, sometimes this menopause can be delayed till 55 or 60 also, but on an average you are there at the 50. You have completed family, so you are, I hope you are not any more kids, and these fibroids they are multiple, and the larger is the 5 centimeters. So 5 centimeter is a moderate size. It's not very large or giant, or it's not very small also, but these multiple fibroids and this large fibroid, moderately sized fibroid, will causing you the symptoms like bleeding 2 times a month. So looking at that, so your hemoglobin might be towards the lower side. I will suggest to go for the fibroid embolization, because it's a very minimally invasive treatment. There are no cuts, no sutures, no general anesthesia, and it's a daycare procedure or 1 day admission is required, and there are no cuts because in the embolization we are stopping the blood to the fibroids, so the overbleeding problem will be solved in a cycle or in a 2. So that will be better, because you are almost there for menopause. I don't recommend you to go for a hysterectomy or myomectomy, because myomectomy you have multiple fibroids, so they will be removing the large fibroid, and sometimes the smaller fibroids will be remain, and your problem may not be solved completely. So in your case, first choice should be the fibroid embolization, considering your age, number of fibroids, and you are not expecting any kids, and your symptoms as well mainly. The other thing is you can go for the myomectomy. At last, I don't recommend hysterectomy, because you are almost there for menopause. So once the menopause stop, automatically the bleeding will stop. So I hope I am able to give you the right suggestion. If you have any further doubts or questions, please ask them in our videos. I'll be happy to read them and answer them in our next video. Thank you.